Yes, most of all because now I can use advantages of the BLX design related to immediacy and also the advantages of digital technology, most of all of guided surgery, combining these two worlds. Remove bone in a different way, you can reduce the amount of temperature that you are gaining meanwhile you're drilling. So it's a very, very good design and a very interesting concept. Well, one of the good things about the CAD/CAM world is that you can have predictable and faster results, and also again combined with this immediacy concept, you can have, for example, a chairside provisional or a chairside customized healing abutment after surgery in a couple of minutes. So it's something that is, of course, changing the way that we face our profession. For my colleagues who haven't tried the guided surgery system yet, of course it's going to give you a different perspective and a different way to treat your patients. And what we want to do today is to treat our patients in a very predictable way, but also faster. So I recommend you to try it for sure.